Thank you for listening to the Healthy Project podcast, where we get into conversations about health equity, public health, and how to create a healthier community for everyone. I'm your host, Corey Dion Lewis, and together we'll explore innovative solutions, discuss the barriers people face in accessing quality care, and hear from leaders in the field who are making a real difference. Whether you're a healthcare professional, community advocate, or simply someone who cares about health equity, you're in the right place. Let's get started on creating change one conversation at a time. Hello, everybody. Thank you for listening to the Healthy Project podcast. I'm your host, Corey Dion Lewis, and today we are getting into a critical and very important topic, prostate cancer awareness. And as we all know, September is Prostate Cancer Awareness Month, so dedicated to that. So with my guest today, not only will we be discussing that, but also I would love to talk about kind of the equity piece as well. So with us today, I have Kris Bennett. He's the Director of Prostate Cancer Health Equity Initiatives at Movember, who is a global leader in men's health. We're going to be talking all that today. So again, Kris, thank you so much for being here. I really appreciate it.
Corey, appreciate you having me on, brother. Excited to talk more about this and just kind of get this message out, man.
Yeah. So before we get into the conversation, can you tell the people a little bit more about yourself and what gets you up in the morning?
Yeah, absolutely. So a little bit about me, my background. So I actually have my master's in public health as well as my master's in social work. So that was a dual degree that I finished up at Alabama not too long ago, actually. So that was a tough one. I also have my master's in management, which I received in the United Kingdom, so Durham University. And what got me over there to Durham actually is always kind of my fun fact. So I know you can't tell behind the screen, right? Or on a podcast, but I'm actually 6'8". So I played professional basketball before I jumped into this space. And that actually kind of led me to the kind of public health world. So I played in multiple different countries all over the world. While I was playing in South America, I started to realize, some of those public health issues and barriers that folks faced. And that kind of got me into it. So I actually started my public health master's while I was playing in Nicaragua, I believe. Started at a different school than what I finished at. But that really got me into it. And then, of course, paired with when my mother was diagnosed with cancer, I started to see kind of how those big systems play into accessing care. And so that kind of got me into it. And that's kind of led me here. I've always been a proponent of health equity. I kind of laugh because all of my practical experience after I played basketball, or real world experience, if you will, has been centered around health equity. And so, I've worked in federally qualified health centers. I've advised politicians at state and also federal levels, all on health equity policy. So I would say, honestly, what gets me up in the morning is just doing this work for our communities, just for anybody that's coming from a historically or intentionally excluded community. I want to be, I want to use the privileges that I have, being light skinned, having the educational background that I have. Having the kind of platform that I have to be able to help make sure that people have access to those types of things, especially that are going to help them with better healthcare.
Word. So pretty much you went from dunking on people to helping people. So that's
I've never thought of it like that, but I like it.
That's awesome. That's awesome, man. And I love what you're doing, and I would really to kind of play on that health equity piece. I know you said that's been your journey ever since you finished, your professional career or professional basketball career.
Yep.
Why when we're talking about under-resourced or underserved communities and prostate awareness, where is that connection? What does that look like?
Yeah, absolutely. So my role is global right now. So I definitely can rattle off a few global statistics, but one of the biggest statistics that I think is kind of palatable, right, for folks to really understand is prostate cancer in general, globally, is the second most commonly diagnosed cancer in men, behind lung cancer. And then when you really get into it, especially in the United States, Black men are disproportionately affected by prostate cancer. So in general, again, in the US, that number is 1 in 8 men are going to be diagnosed with prostate cancer in their lifetime. But it balloons to 1 in 6 when you're talking about Black men. And so the reason why health equity in prostate cancer is so big to me is because there are so many different kind of factors that play into prostate cancer, whether it's a lack of conversation around anything that has to do with our sexual reproduction system. It's the genetic pieces. There are genetic factors that kind of go into play, environmental factors that go into play, of course, those socioeconomic factors. And that really does include, the unequal access to healthcare as well as early detection services that most folks have access to. But not everybody, obviously, and I think everybody that's probably listening to this knows this, but of course, not everybody has access to those types of things. And so for
Right.
me, I got into the prostate cancer space because, again, I came from the general health equity space. So I was, I've kind of done this everywhere across the spectrum. But when I noticed what those numbers were in the prostate cancer world, it was really jarring for me. I think that's really the appropriate word to use, is jarring, because those disparities are so eye-opening to me. And so I said, you know what can I do to, again, kind of help out? And I think everybody, honestly, if you have those types of conversations with your homeboys, with your family, anybody that has a prostate, you'll recognize that pretty much everybody has some kind of run-in with prostate cancer, whether it's a scare or BPH, so an enlarged prostate. It's just something that happens quite often, especially in our communities, in Black and Brown communities. So it's a conversation that I think is warranted, and one that I really want more people to have.
Yeah, you hear about. I definitely have had conversations.
Mhm.
I know people have had issues, and then you kind of talk about some of those numbers, especially within for Black men,
Mhm.
and then it raises the question: well, why are the numbers that now, given
Yeah.
all the information that we have? And
Mhm.
I have my own opinions on why that conversation around
Yeah.
prostate cancer is not as strong as it should be. But I would love to hear your thoughts on why still now,
Yeah.
2024,
Yeah.
are we still having there's this huge disparity gap when it comes to prostate cancer
Absolutely.
and men of color.
Absolutely. So I mean, I think there are so many different factors that kind of go into it, right? And I think,
Mhm.
as someone who, of course, spends a lot of time in this space, you hear about the advancements, you hear about how numbers look like they're getting better, right? And there really has been a lot of there have been a lot of advancements in the cancer space. And I would say, honestly, over the last like 5 to 10 years, right? Like, while I've been doing this, there's been a lot of advancements that have occurred. But to your point, Corey, there are still those disparities that exist within Black and Brown communities, predominantly in Black communities. And so, for me, some of those factors that, again, that kind of contribute to that are really, you have so you have the genetic predispositions, right? That's one big piece of it. Again, the socioeconomic status piece that goes into place there. Access to healthcare, right? Especially in the United States. One thing that I think is really interesting is, you know, the access that you get to healthcare really is just, it's determined on if your job has good healthcare or not, right? And that's something
Yep.
that, obviously, I don't believe that should be what it is. I believe healthcare is a human right, and I believe everybody should have access to that. But unfortunately, that's not how things work in the United States, right? So that access to healthcare piece is a big thing. And then I think that last piece that you kind of maybe potentially alluded to, are those kind of cultural barriers, right? Black men in general, we're not necessarily having those types of conversations around prostate health, right? I know one thing. I've been very fortunate to travel across the world, across the country, to have these types of conversations with a lot of folks everywhere. And one of the things that I consistently hear is most men don't even know what a prostate is until they're diagnosed with prostate cancer, right? And that, to
That's
me,
real.
is an issue. And so I think that's why, we talk about Prostate Cancer Awareness Month. Well, we don't really talk about it. I hope we talk more about it. But, you mentioned the awareness piece at the beginning of this conversation. And I think that is a big piece to what we should be kind of having that conversation and starting that conversation. That should be probably a top five conversation starting point, right? Is, what is a prostate? Why is it important, especially in Black and brown communities? Why should we start having these types of conversations earlier, to kind of normalize and socialize these types of things?
Yeah, you'd be surprised how many conversations I have at my office, Chris, explaining to men the difference between a colonoscopy and a prostate exam
Yeah, yeah,
because
yeah.
they think it's the same thing.
Dang, right. Yeah, yeah.
You
Yeah,
know,
I can't tell you the amount of times. There's actually a really great documentary that's out there, and it's you can access it on Tubi. It's also on Amazon Prime. It's called The Silent Killer by Londi Maduro. A
Mhm.
really great film, and it's a little bit older now, but there's a one part that's really interesting, and it's pretty much this guy that's just going around streets of LA, so in my backyard, just kind of walking down the streets, asking people, "Do you know where your prostate is?" And the amount of folks that don't know where their prostate is, that don't know what a prostate is, where it's located. I don't know. Like, as someone that spends a lot of time in this space, of course, I recognize my privileges of understanding these types of things.
Right.
But I do really want this conversation to be more normalized, right? And I grew up with all women, so for me, I've always been somebody that does like to talk about health, right? Women are obviously much more socialized, and it's much more common for women to kind of talk about these types of things from an earlier age. And so I'm really hoping that's a conversation that we can start to have with our younger men at an earlier age. Not to scare people, but just to have them just kind of up on game a little bit more.
Yeah, 100%,
Yeah.
100%. There's something I want to touch on that you said earlier when we were talking about, barriers to care,
Yeah.
um, and having access to care.
Hmm.
And there's something that I've been really, it's funny we're having this conversation now because there's
Yeah.
something that I have been really thinking hard about the last couple of weeks.
Yeah.
And that's having, true access to care,
Yeah.
meaning, you know, there are people who have insurance, I have insurance, I have that privilege, but do I have access to a provider that
Yeah.
understands me?
Yeah.
Right.
Yeah.
So I have access to care, but do I really have true access to care?
Hmm.
Because I may have a mistrust of my provider. And I don't. If my provider's listening, I trust you.
Yeah.
But not everybody's me has that
Yeah. Yeah.
experience.
Yeah.
So when we're thinking about, those men out there that may have access to care,
Yeah.
what are some of your thoughts or ideas about, getting comfortable with a provider, or what does
Yeah.
that look like?
Yeah, I always tell people, and I'm so glad that you brought this up, because I think this is such this flies under the radar a lot of the time, right? Is, what does trust actually look like, especially in
Yeah.
the healthcare space? And I think, I mean, we all know about it, right? We could talk about this Tuskegee experiment. We can talk about Henrietta Lacks. There is such a deeply ingrained distrust of the medical system, and rightfully so, right? And so I think, as medical professionals, and this is something that, again, I see this as a privilege that I have right now, being in the space and really, being able to help folks. I'm grateful for this opportunity, because I think this is the opportunity for us, as the kind of medical professionals, to extend the olive branch to the folks and into those communities that have, again, been historically and intentionally excluded from these types of conversations. For us as those medical professionals to say, hey, this is something that we've done wrong. Extend that olive branch, admit that we've done these types of things wrong to communities, and then try to really build that trust. And I think this is something that really does need to start at an earlier. It needs to start much earlier, right? I know I have my MPH, so I really do think of things from a preventative standpoint. But I think, as providers too, right? Like, a lot of providers have a hard time understanding that trust is a big piece of kind of engaging the folks that are seeing them, right? So, what does being a trustworthy partner kind of look like? I mean, that means showing up as competent, reliable, and honest, right? So if you can have those three types of characteristics as a provider, I'm really hoping that providers listen to these types of things and then say, hey, what can I do to really engage the folks that don't look like me, that don't come from the same types of communities? I mean, I've been at federally qualified health centers that are kind of working with populations that are really, really, really tough to work with because of all those kind of barriers that they're facing, right? And I'll just give you an example. One time I was working with a provider who was talking about a patient who was homeless, right? And so
Right.
this provider kept saying, like, I can't get this person to show up for a sleep study. Like, I can't get them to do their sleep study. And I think it was a conversation that this provider had to have with the community health worker who was working with that patient, to say, hey, this person is actually like does not have a house to go to, right?
Mm.
So I think these are the types of things that, providers sometimes, everybody gets stuck in their job, right? Like everybody, everybody really thrives in their job, hopefully, and really enjoys their job, hopefully. And sometimes it's hard to look outside of what you're doing. And so I would definitely challenge providers, healthcare administrators to really look outside of just the systems in which they're looking at things, that lens in which they're looking at things, and really try to take a more holistic approach, because I think, those are the types of things that do kind of go on outside of this. And to your point of being able to trust people, you're going to have to build up that trust. And a lot of times the populations that we're trying to work with do have a lot of things that are going on outside of just, that 15-minute, 20-minute appointment that they're going to. So, I think there's a lot of things from I don't like the term culturally competent, because I think it kind of feels,
Mm-hmm.
I don't know, it feels a little safe. But from that perspective, right, from that culturally competent perspective, those are the types of things that I really hope that providers can work on. And again, health administrators and health systems in general, to make populations feel more comfortable, and also make them feel like they are being engaged in those types of conversations, right?
Right.
I think we try to have these types of conversations where, again, as healthcare leaders, we're trying to propose these solutions without actually involving people that are from the communities in those conversations. And so when we're talking about like, hey, we really want to hear your voice, like how much do we really want to hear those voices, right? And so that's going to be that kind of readiness piece that I think is we have to take into account.
Yeah. Well, and all of that, and the customer is changing.
Yeah,
Like
absolutely.
before, you have a patient. Like there was a generation where a doctor can tell a patient anything and they will just do it.
Just believe it, right? Yeah.
But
Yeah.
now, these cats these days, including we have questions we want to ask.
Yeah.
And if you can't answer those questions in a in a genuine way or whatever, like that will break that trust for some people.
Absolutely. Absolutely. I think it's, that is so accurate. And I think that is something that, I tell people all the time. One of the biggest things that I would tell folks was, if someone was diagnosed with prostate cancer, or you took your PSA test and then you got numbers back and they were elevated, I would always say, hey, go get a second opinion, right? I think oftentimes people forget that that providers or doctors are they're low key working for us, right? So
Yeah.
we should feel empowered, and I think this is something that I want to be more involved in, and why I got into this space, because I want people to feel empowered enough to do those types of things, right? If you don't feel comfortable with your provider, and I mean, I hope people listen to this, right? If you don't feel empowered or listened to or respected or valued by your provider, there could potentially be somebody else out there that's better for you, right? Like, I understand that there's going to be barriers. Sometimes you might live in a rural area where there might only really be one provider. But I would definitely say there are resources out there for folks to be able to access those types of things. American Cancer Society is a really great one. Zero Prostate Cancer in the United States are really another really good one. Movember is another really good resource. FEN, there's so many great resources out there. So if there are those types of things that kind of come up and you don't necessarily feel heard or respected by your provider, I always tell people, hey, you have the ability to find somebody else, and you don't have to do it alone, right? Like that's the piece that I really want people to hear and understand.
No, that's real. That's real. I would love to talk to you about age. And
Yeah.
I didn't know if you had any information.
Yeah.
There are a lot of cancers. I know, colon cancer,
Mhm.
where it was like, hey, you need to get it at this age. Your colonoscopy for Black men.
Yeah.
That age has, hey, now it's like 45 or 40 or something like that. Is there data? Or are you seeing that men of color are getting prostate cancer younger and younger?
Yeah, and so that is cancer in general. That was something that came out in the previous ACS report. They're kind of like 2024 report that just came out a few months ago, actually. Cancer diagnosis age is decreasing. So we're seeing younger people being diagnosed with cancer. And I think, that's for a whole host of reasons. I'm not a provider.
Right.
But I definitely feel like if you were to read the report, you would get a pretty good sense as to why. But yeah, with especially with Black men, right? You see that age being significantly younger than potentially their white counterparts. And so I know there's a lot of research, a lot of data right now that's actually suggesting, and I tell people all the time too, I feel comfortable saying this, uh, if you are a Black man or of African descent or Caribbean descent, we want you to get that PSA test, which is a simple blood draw, by the way. We want you to get that a little bit earlier. We also want to make sure that if you have a history of prostate cancer, that you're getting that test done earlier. We also want to make sure, again, even if you're a veteran, again, get that test done a little bit earlier. And then I think one of the pieces that doesn't necessarily get a ton of it's not highlighted a ton, but it is something that there's a lot of studies being done on, is the BRCA gene mutation. So for my personal family history, right, my mother had breast cancer, and so for me, I want to go get my PSA test as soon as I turn 40. I want to go get my PSA test done, because I want to make sure that I'm not at higher risk, because there is a correlation between breast cancer as well as prostate cancer. I want to say ovarian cancer is in there as well. And unfortunately, if someone does have breast cancer, ovarian cancer, there could be a more aggressive form of prostate cancer that you could be diagnosed with. So we want to make sure that folks are getting tested earlier, so that PSA test, super easy, simple blood draw. You can check, again, you can check on resources on kind of advocacy groups. Zeroprostatecancer.org does a really great job of that, where you can actually you can check out where there are free testings being done. I know if you're in the New York area, Mount Sinai they actually have a mobile unit that goes around, and you can go do that. UCSD here in San Diego, where I'm located, they do a really good job of making sure that folks can get tested as well. So there is a whole host of free access to PSA tests. And then they will make sure that you're connected to people that can then take care of you if something does pop up. So again, from the age piece, like folks are being diagnosed a bit earlier, especially if you kind of have those, if you have that kind of background, if you're a black man, have a family history of the disease, or a veteran, those types of things. We want to make sure that people are being tested earlier. Because unfortunately, what happens is the U.S. Preventative Task Force actually says around 50. 40 to 50 is a 10-year gap, right? So you could potentially go from being diagnosed at stage 1 to stage 4. And I've seen that happen quite a bit, to be honest with you, where I've seen men that just were like, oh, like very active. I'll just use a quick example. Really active cat, played basketball, dude that I knew, really never talked about like cancer, was never really unhealthy, always kind of active. Unfortunately, I think he was 44 actually, and then was diagnosed with stage 4 prostate cancer, and it had metastasized. So these are the types of things that like do happen, unfortunately. I could give you a whole list of cats that are diagnosed with late stage prostate cancer. So definitely one thing is to just kind of stay on top of it, understand what your numbers are, what your PSA numbers are. Just like everything else, right? Like you want to take care of your body. I'm an ex-athlete. I always said, you know what? It's just good to keep that maintenance going, right? And it's better to know, because your quality of life is going to be significantly better if you do catch it earlier.
Yeah, I'm catching it earlier, and that brings up my next thought and question, is understanding maybe some of the symptoms.
Yeah.
One thing that I realize is that there are men out there that don't know what to look for, or maybe they've had symptoms,
Yeah.
and just thought it was just natural or
Yeah.
normal.
Yeah.
Your thoughts on that, and also where people can find resources, and
Mhm.
what experience did you have with that?
Yeah, absolutely. So prostate cancer is it's one of those weird ones, right? It's actually called the silent killer, because there really aren't a lot of symptoms with prostate cancer. Which is why I always tell people, again, just kind of stay on top of it. You want to make sure that you're getting those tests. You want to make sure that you're staying engaged and actually seeing a provider. I think this is kind of the plight of this is kind of the plight of being a black man, right? Is we think that we're superheroes until we're not, right?
Mhm.
And so I've always been one of I actually went to a random church in Albany, Georgia, and I remember sitting there with a black woman who had lost her husband to prostate cancer. So we were just kind of chopping it up there. And she just said, you know what? I wish that he wouldn't have sat there and gone through it alone. And I wish that he would have just continued to go see his provider and doctor and not felt like he had to be so strong. That's unfortunately something that I've heard quite a bit. And so, again, I'm just really urging, if I had a call to action, I guess this would be it, is to just, go see a doctor, go see your doctor, challenge yourself to get engaged with a provider, go get that PSA test if you're eligible for it. Just make sure that you're doing that maintenance that you need. As somebody that I'm not old enough to do it yet, but again, as somebody who has the privileges that I have and has the platform and has the platform that I have, I want to make sure that people are doing those types of things because we want you here, right?
Right.
I've had family members that were diagnosed with prostate cancer, and I've heard these stories again where people are diagnosed with prostate cancer, die from prostate cancer, and then don't talk about it. And then it's like, another generation gets diagnosed with it. And you're like, why didn't I know about this? And you're like, oh, right. My uncle was diagnosed with the cancer, but we didn't know that it
Right.
was prostate cancer, right? Because they're not having those types of conversations.
Right.
So I definitely want to continue to challenge us as a people to continue to have these types of conversations and just again normalize it, socialize it, right? These are conversations that are going to keep us alive. They're not conversations that are going to hurt us. We don't even know if we're going to be diagnosed, right? Like we might not be diagnosed, and I know it's scary, but it's so much better to know because this is such a survivable cancer. I mean, again, as someone who sits with statistics all day, I can tell you it's like 98% of the people that are diagnosed with prostate cancer, if caught early enough, you're going to have within 5 years, you'll still be alive, right? Like you will
Mhm.
be alive if you catch this disease early enough. And on top of that, your quality of life will be much better. So we want to make sure again that people are kind of having these types of conversations. Just again, challenging folks to really have these types of conversations to ready the community. Because I think oftentimes we just haven't had those types of conversations in our community, so we're not necessarily even ready to have those things.
Right.
So I would say again, I guess in terms of resources, FEN does a really great job of reaching Black men in the United States. Zero prostate cancer, they do a really good job of that. Of course, Movember does a really great job of that. American Cancer Society is another really good resource that even provides access to specific programming where if you need transportation services after you're diagnosed with cancer, they will help you do all of that. They also help on that advocacy side too, right? Because I think I'm definitely somebody. My dad is linked in with the Black Panthers, so I'm somebody who loves protests, right?
Mm.
But I also understand the policy side, of course, coming from it.
Right.
So I always say you need that policy and protest to really make things happen. And so American Cancer Society does a really great job of advocacy. And again, you can kind of link in with your local senators to kind of have those types of conversations. Go visit them, drop in, ask about the PSA for Him Act, see what they're doing about that. The PSA for Him Act actually is a specific policy piece that is working to really help reduce some of those barriers to PSA tests. So, somebody in the rural kind of black belt, right in the South, might be having to go get a PSA test, and it might cost $40. For me, I'm very fortunate, right? I live on the coast. I am very fortunate to have a job where I'm like $40 isn't, it's a lot of money, but it's not a lot of money, right? I'm not going to
Mhm.
miss a bill. I'm not going to miss childcare. I can, I can take a day off from work to go do that. For somebody who might not necessarily have those same resources, you're missing out on, now you're having to pay $40 and you're
Right.
missing out on work. And this is the difference between, going to the grocery store or paying for your child's, whatever it is. So we want to make sure that we're eliminating some of those barriers. So that PSA for Him Act actually does help eliminate those barriers. So then it's a free PSA test, and that's across the board. That's federally. So we want, again, just those types of things, protest policy, There are really good groups out there that are doing really great work locally and also kind of at that federal, national level. And I just, again, kind of want to make sure that we're having those types of conversations.
Perfect. No, I love that. So, like I said earlier in our conversation, Kris, that Movember is one of the leading, voices
Mhm.
in men's health. Talk to us a little bit about some of the initiatives and things that you guys are working on.
Yeah, absolutely. So there's one initiative that I'm a little biased because I oversee it, right? But it's our it's our Prostate Cancer Health Equity Initiative, and so I love this because one thing that I constantly say is you have to give the folks, you have to give the folks closest to the pain the power, and so this specific initiative is doing just that. We're working with partners just nationally, and all those groups are specifically focused on different kinds of barriers or different kind of populations across the United States, and they're working with community-based partners to then say, hey, what are those types of things that are going on? How do we help you how do we help you actually kind of achieve those goals that you want to achieve, and also help reduce those barriers to prostate cancer. So I can't give away too much because we're in the contract phase right now of getting all those contracts signed. But the biggest thing that I love about it is we're breaking down those silos where now we're having organizations that are working with community partners. We're having big institutions working with community partners. We're having community partners actually coming to the table now, right? They're building their own tables and then they're bringing it to these institutions who do have a lot of pull in these places. So then we can really see sustainable change. So I'm really excited about this specific project just because, again, it's giving people the power that need it, right? It's leveraging the bigger organizations like the Movembers or the bigger academic institutions to leverage their powers and really work on that power sharing dynamic, to make sure that folks that are experiencing that pain, that are experiencing those barriers and those challenges, that they have a voice at the table to say, hey, this is what we need, versus these bigger institutions or bigger organizations or foundations just kind of coming in, dropping money, and then once that dries up, leaving,
Right.
right? And so I think that's one thing that I'm really excited about with this specific project. And I'm really grateful that Movember did a lot of this work even before I came in, to be intentional about these types of things, right? It's not, they're not just checking boxes off. They're genuinely trying to figure out what it is, that these communities actually need. So I'm grateful to be a part of this project. I'm grateful to be overseeing it. It'll be rolling out in the next couple of months, so I'm really excited to see what that looks like. And yeah, just again, in terms of a future oriented piece, I think it's going to be something that we'll get a lot of really great learnings from. And hopefully we'll be able to continue that work moving forward.
Man, that's so dope. That's so dope. Well, hey, Kris, thank you so much for being on the podcast with me today.
Appreciate
For those listening or watching, um, if they want to learn more about you, learn more about Movember or whatever, where can they find you?
Yeah, Movember.com for Movember information. I'm on Instagram as well, that kid juice. And then I'm also on LinkedIn, and just Kris Bennett. You'll find me on LinkedIn, Kris Bennett, and then you can just look up my master's in management and all that other good stuff, and I'll be there. But yeah, please, if there's any questions, if you find me on LinkedIn, Instagram, whatever, please feel free to ask. And again, let's just continue to have these types of conversations. Corey, I appreciate you putting on this type of platform to be able to share these types of messages. It's great to see folks that look like us doing these types of things. And again, just really, really happy to be here and grateful for you to be able to share this message.
Yeah, man, I appreciate it. I appreciate it. Well, again, Kris, thank you so much. And everybody, thank you for listening to the Healthy Project podcast. I'll let you next time. Thank you for tuning in to this episode of the Healthy Project podcast. I hope you found today's conversation insightful and inspiring. Remember, health is more than just access to care. It's about equity, understanding, and community. If you enjoyed the episode, don't forget to subscribe, leave a review, and share with someone who could benefit from this conversation. For more information and resources, visit us at www.healthyproject.org. media.healthyproject.co. If you're interested in sponsoring an episode or partnering on a series, I'd love to hear from you. Reach out to me at Corey@healthyprojectmedia.com. Together, we can build healthier and more equitable communities. Until next time, take care, stay healthy.